Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Zoe Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. What if the way your horse places their feet is telling you something important about their body?
If your horse is walking like they're on a tightrope, placing one foot directly in front of the other or crossing the midline, this isn't just a quirky movement pattern.
It could be a sign of instability, compensation, or even underlying pain.
Today, we're helping you make more sense of rope walking, what might be driving it, what to look for, and how to respond in a practical way.
Hi everyone, let's dive into this discussion on this gait abnormality. Hi Soph.
Hi, this is such an interesting one because once you see it, you start noticing it everywhere. So by the end of this episode, you're going to be able to recognize rope walking in your horse or any horse you come across, understand the most common underlying causes, and start to assess and improve it with practical strategies. So what is rope walking, Raquel?
Yeah, I've seen this a few times in my career, treated horses with it. So it's when horses place their feet on or across the midline of the body, almost as if they're walking on a tightrope, and it can occur in the front legs or the hind legs, or sometimes in both. And this was actually a listener request, this episode, so that's why we decided to do it. There may or may not be kind of obvious instability, but if it's something that you notice, it's definitely worth paying attention to. So, as a listener, have you guys ever seen this before, rope walking? Because, we'd love to hear from you. One that stands out for me is I had a horse, it was years ago now, a big Percheron mare, and the owner actually called me out in the middle of the night. I knew her well, and she said, I don't know what's wrong with my mare. It's not her feet. I've checked her feet. She was a trimmer, and it kind of looked like feet. And when I got there, the horse was rope walking, and so I started investigating. And then when I felt her pecs, she was like, ow, and she had just ripped her pecs. Pretty sure it was bilateral. She was rope walking on both sides, and she was in a lot of pain. It was also, I remember the first time I met Sharon May Davis actually discussing this case with her, because it was the first time I'd ever seen an acute pectoral tear, and it's not something that we ever are taught about at vet school. Like with lameness, we look at the joints, we joint block, nerve block, but we rarely look at the pecs. And I've now seen a few lameness causes from the pectorals in acute situations, a couple of endurance horses and then other horses. So, yeah, she was definitely rope walking, and it took us, quite a few months of rehab, because she was a massive horse, to get her comfortable in that area. So, yeah. How would you explain to people how they could recognize rope walking in a bit more detail?
So, the key is to watch where the foot lands. So, in a healthy walk, the forelimb swings forward and it lands in line with the shoulder. So if you kind of have a still frame or a picture of your horse while they're walking, you'll see that the hoof is directly below the point of shoulder. So the point of shoulder is about where the shoulder joint is. And you can also see so when you're standing in front, that's when you can see the rope walking or the healthy walk in front. But when you stand behind, you should be able to see that the hind limb follows a similar aligned pattern below the hip joint. So the hip is a little bit off the side of the top of the tail, and so the horse's feet shouldn't, there should be a little gap in between the back feet while they're traveling forward. With rope walking, the limb drifts over to the midline, or they even cross over. And it can look like there's an invisible tightrope between the legs, and the horse is trying to walk along it. So their feet are sort of going like they're crossing over in front of each other. So yeah, an important observation point is to make sure that, if you're looking for forelimb tightrope walking, you've got to look from your front, because it's not something you're going to see from the side. And for the hind feet, you've got to have a look from the back and see where do the hind limbs land. A really useful test is walking downhill. It becomes much more obvious on the downhill. The reason for this is because the horse basically has to search further with their foot before it lands on the ground. It's kind of like there's a bit of a step down. And so the horse, as the horse's leg lands, the pectoral muscles are actually coming into engagement. And so you'll see this extra swing across. There are other things that can contribute to rope walking, but on that downwards, on the downhill, it really becomes quite exaggerated. And it's the same with the hind feet as well. So it's important to know that a horse with good stability should maintain that alignment where the hoof is directly underneath the leg in all four legs. It's not normal to be rope walking. It's not a habit. It's not just a bad habit for no reason. It's always something that you like. There's a reason for that. And if the rope walking gets, if horse does rope walk, but it's worse downhill, or it just turns up when they're going downhill, it usually means there's underlying weakness or dysfunction. So we're going to break this down into front and hind limbs. Raquel, can you tell us about common causes for the front limbs?
Yeah, well, obviously in the front limbs, one of the common causes is pectoral damage. So in the chest area, which is a really common area, as a body worker, where we see damage, because horses slip and slide and get away from other horses if they're in a paddock with them and create tears. And they can also just get really tight in there if they're not kind of using their posture and balance appropriately. So that's one area. Another thing could be there's a shoulder injury, and so they're unable to maintain like stability of the shoulder. And so you're getting like a shoulder instability as they come into weight bearing. Sometimes they can rope walk a little bit with Sweeney, which is where they've had damage to the nerve that supplies the inferent supraspinatus, which go along the scapular area, and they stabilize the leg. Well, they stabilize the whole shoulder, so you can get a lateral motion of the actual shoulder joint, but the lower limb, can land quite wobbly under the body. Also, if they've had any sternum or rib trauma. So, if a horse is running really fast and they fall and then they land on their sternum, or they try to clear something and they don't quite clear it and they hit the front and have a rotational fall, or they get kicked in the sternum or the rib area, or they could have some of it from birth trauma as well, like in the ribs, and then that can create compression across from the sternum to the shoulder. And so the leg might come more inwards. The other time I've seen it actually with Jelly, when I've put on certain girths, he will do it with his front legs. And so he did have a pec injury last year sometime, and I remember him pulling the leg away from the trimmer a bit, and also when I would girth him up, he would cross his front legs, and he didn't do it when he wasn't girthed up, but it was partially the girth because he was wearing a different girth that actually has sternum pressure. So it was partially that, but then it was also that he'd done some pectoral damage at the same time. So if they always do it under saddle, then you want to have a look at your girth positioning, your girth comfort, your saddle fit, because they'll also do it when there's a lot of pinching in the wither pocket area, or if their scapulars are quite restricted in their motion, often from poor saddle fit, then they can just kind of get stuck in there and they're kind of throwing their legs over. And then the last one, which if you're suspecting it's a neurological condition, and that's where, they might have it with the front and the back legs, and they might seem more wobbly with it. So it's not just positional, like it seems like they're lacking control. It could be a problem in the neck. And so, you've got spinal cord compression affecting the nerve supply to the limbs. So, yeah, they're kind of all the common causes that you want to be aware of, and we'll talk about how to investigate those a little bit more. They're all going to affect how the horse loads the limb, how they stabilize through the shoulder, and then how they control that limb motion and placement. What about for the hind end?
Yes. Hind end rope walking, a lot of the common contributors can include medial thigh or groin discomfort, so the inner thigh, the inside, high up underneath, sort of in where you've got, the udder or the gelding sheath or salion up in that area. So that whole area can have so many things happen. What you're talking about with the pectorals, you imagine can basically happen with the hind end as well. They can have slips in the paddock, they can have falls, they can have tension in an area simply because they have a poor posture, or they've got a braced abdominal tension because they are lacking really good core function. So many things can cause tension in that area, and they can be predisposed to injuring them, from small things. You can have lower back and lumbar tension or discomfort. So because of the anatomical connections between the lumbar and the pelvis and the hip and the medial hind limb, which we've discussed in quite a few episodes, including the sacropelvic dysfunction and a pelvic alignment episodes, there's a really big connection there. You can have dysfunction up high, and you see the representation, the thing that you notice is going to be that rope walking. So it's really important, if you see that popping up, it's something that's going to trigger, okay, I need to get investigations into this. You can also have gelding scars. So there's a lot of fascial connections up into the underside of the sacrum and the lumbar for geldings, and so you can, we've heard incredible stories from people who've had work done on their gelding scars on the psoas area, mares who have tension up in that area, so it's not just geldings, mares can have pain and discomfort under the lumbar and sacrum area with their ovaries, and all of that space can influence how the horse wants to move their lower limb. You can also have abdominal injuries. So some of the abdominals connect up onto the pubis, so that the pubis is right at the top, up underneath the back legs. And so at those attachments, that you can have tears and pulls, little injuries, strains, or they can tear off the bone as well. There are lots of things that can happen, and that can be really destabilizing because the abdominals are so important for barrel control and the stability of the pelvis, which influences how you're going to use your hind limbs. If you're accommodating for a dysfunction up high, you're going to have to change how you load and how you balance. And you will see all of these in the way that the horse loads the limb, their stability, and their ability to maintain alignment under load. So lots of horses, as they're going around, you'll see that their leg is very twisty. If you walk them in a circle, or as you're going downhill, you're going to see that rope walking increase. And so it can be very prominent, or it can be less prominent as well. If you're seeing your horse sort of moving towards rope walking, it's still cause for concern. Even if if you go out and you say, oh, my horse doesn't actually land one in front of the other, if they're still really close behind when they're standing still, or if they're moving, it's always going to be cause for investigation. And of course, if it's present in both front and hind limbs, or it's really severe, or as you were saying, it is accompanied by instability, it looks wobbly, then you really need to consider neurological conditions, and veterinary assessment becomes really important. So If you're seeing both of those, or you come across a horse where you do see both of those and somebody's wondering, it's very important that that assessment comes important, because there are tests you can do to challenge the horse and see what their neurological ability is like.
Yeah, so you can investigate that front limb area. So from the neurological perspective, if you want to investigate that further, then have a look at how your horse is able to walk downhill and whether they hover a little bit with the front legs or whether they want to stop going downhill. That can be a sign of instability. You can also hold their head up gently in the air, and if they feel like they don't know where their front legs are, then that's a concern. Or if they're walking along and you just gently push them, they should stabilize. And so if you feel like you can gently touch them and they lose stability, that could be a cause for concern. However, if you're concerned about any neurological aspects, then you should contact your vet. But you can become familiar with palpating areas of your horse. So in the functional posture course, we go through the common areas to palpate, and pectorals are one of them. So, running your hands through the horse's chest from the front down each side, feeling along the sternum, feeling in the middle of the pecs, feeling that girth area, also the pecs up against the limb, getting familiar with what that should and shouldn't feel like, and there shouldn't be any reactions there, and becoming familiar with how those muscles alignment kind of feels. Also, just gently palpating along their neck vertebrae to check for any reactions. Checking with their sternum. If a horse can do a good belly lift, then you've probably got reasonable rib cage and wither function. But, just gently kind of pressing through the sternum and the withers and checking for any sensitivity in that wither pocket. And then just asking yourself the question, does it occur when they're ridden, unridden? Is there certain circumstances? Has it always happened, or is it something new? And then the same with the hind end, looking at your pelvic alignment, looking at your sacral function, having a look at the musculature of the hind end, because often the horses that walk really close behind will have really weak musculature. So it can just be a horse that is really weak. They lack muscle. Maybe they're malnourished as well. That could be another time that you'll see it. But you want to look at, do you have pelvic symmetry, or is there a marked asymmetry? Is there marked muscle loss over the rump or the quads? And is there any pain when you're kind of palpating through around that pelvic area? And that's where, generally a good quality body worker will be able to assess that thoroughly and up in the groin, depending on the horse. So, but there's lots of things that you can do to help you, so if you are noticing rope walking and it's not acute, or you've kind of figured out what it is, then you want to come up with a bit of a plan for rehab, which would hopefully be supported by a vet or a body worker. But what's some of the things that people can do to help with progressing it?
So once you know what your issue is, you can help out that area. You can use massage to, work on the muscles. You can use red light over a problem area. You can also use pink goop, which is a massage gel that's anti-inflammatory and soothing. And it's important to move early if it is acute, to get on top of things. Also to, we have a good episode on rehabilitate. It's called Rehabilitating Tendons, but it covers the basics about the fact that rest is not rehab, and the earlier that you get on things, the more influence you have on the tissue healing to improve the structure of the healing, decrease scar tissue. So really important to get on stuff if something is, if you go out and you see rope walking like your trimmer did, and you notice something, then you're really at the start of the problem. But if you notice this and you want to start working on a horse that has this issue and improving, step one is to slow it down. So encouraging slow and controlled movement and conscious placement of the limbs. Conscious placement of the limbs is something we've, again, talked about a lot. It's the ability to mindfully influence what you're doing with your limbs and begin to reprogram the movement pattern. One particular exercise is called the one pole challenge, and it's quite simple. It's where you step over a single pole, but instead of going over the pole, you straddle the pole so that both of your horse's right legs are on one side of the pole and both of their left legs are on the other side of the pole. And so it can be done slowly, and you're just asking them to think about putting space in between. It's kind of like just an aid to make them be aware of creating space in between their legs. But again, this is important if your horse has some sort of structural or functional reason as to why they won't put their legs together, then that should be addressed as well, because you're going to improve their ability to make the most of this exercise, which focuses on alignment and control. What other things can people do?
Yeah, and I think also recognizing with that one pole challenge, it's really hard for horses and it's not something that they naturally do. So just not asking for too much. If you get the front legs there, that's enough, and you might only do that for a couple of weeks before they can progress to the back legs, and then before they can progress to being able to walk over it with the pole in between their legs. And you need to allow them a lot of time to process. And if they are healing, you definitely don't want them to step on the pole and then the pole rolls, and then that creates instability in that leg. So just be mindful about when you're using that exercise, and not doing it too early in an acute situation, especially, and not putting too much pressure on them. You might also just work on improved awareness of the leg and proprioception. So you could use Tellington T-touch wraps on the leg. You also could just use them around the front end to help with, so they're the soft elastic type wraps that allow motion and creating proprioceptive input. You could also, with the proprioception, just controlling, lifting their leg up and down. So just in a static position, having the control of those pectoral muscles, or being able to just do a slight transfer of weight onto the affected limb. So you'd start with those things before you progress to too much in movement. However, don't forget walking is very valuable just in an acute situation. And then your limb mobilization. So initially you just want to make sure the horse is comfortable to pick up their legs. And once they're kind of comfortable to pick up and put down their legs, then you would ask for abduction and adduction. So taking the limb towards the midline, which would release the area and allow it to get some different proprioceptive input from not being under strain, and then create some lengthening through the area, building up to stretching and opening up, say, the chest or the groin. But you just want to make sure that is comfortable and healed enough to go through that motion. And also just through the whole thing, making sure with the stabilization exercises that the limb is weight bearing in its best possible position. So you want to give the limb time to come into correct alignment and not kind of force brace. And then you want to make sure that you utilize your environment. So what could be some examples of people just utilizing their environment to help them with this?
So balanced feeding positions. You can utilize the side of a hill so that your horse is along the side rather than facing uphill or downhill. And that's just going to challenge them a little bit to load one side, and sort of you can even that's in some ways, sometimes it releases the chest because you've had a shift in the alignment from the left to the right limb, and then you can go back the other way the next day, and the same thing happens for the back legs. You can create more movement, you can create obstacles in their environment. All of that, horses who aren't getting enough movement, stiffness and crotchetiness can contribute to rope walking as well. So making sure that your horse has adequate movement. Motion is lotion and good movement is medicine. So making the most of those things. When it comes to obstacles in the environment, anything small, if you've identified with your vet or your body worker that there is a genuine issue going on or a limitation, starting with small obstacles. If you have the ability to create something small that your horse steps over a few times a day, nothing huge because you don't want to over challenge the system, but just a little bit to keep going with the work that you're doing in your sessions with them, and just keep it going in the paddock in a way that is never going to fatigue them, because a couple of steps over a pole isn't going to fatigue, but it's just a little bit of thoughtful movement that's being included in their lifestyle. So definitely utilizing your environment, your variable feeding positions are always going to be useful. Improving posture overall in the body is going to contribute to the horse's ability to regain their stability and their ability to use themselves well. And once you have, in cases where it's not neurological, once you have function and balance and stability back, the body, once it's been shown how, likes to go back to a balanced position. So it's important not to write off those issues as a lost cause, because you have so much influence over the body.
Yeah, but recognizing that if they've done it for quite a long period of time, you are going to have to reprogram those movement patterns and help them find stability in a better position, and that things like the hoof balance could have been changed from that motion. So you might need to address that for a period of time until they come back into balance and actually, balance the feet up, even though it might be caused by the body and the way they've been using their body, to then optimize their change of motion. You might have to, say put a little wedge on or change the feet to support the body. And, just recognize that it is a weak point of loading. So if the horse is loading in the midline, like I did see a horse at the Olympics, whenever that was, last year or the year before now probably, and coming down the midline, its front leg was landing well across its midline. And, it still scored well and everything, but over time, that horse's body is going to pay for that loading if it already hasn't. And recognizing what, hopefully they knew what the underlying cause of that movement was. And sometimes it's exacerbated in bigger movements so that they can control it when they're doing smaller movements, but then they lose that sense of control in the bigger moments. So, yeah, and whenever we're building new movement patterns, it takes time to establish those new neural pathways, and it takes time to establish strength in those new positions. So just think about, first of all, figure out, is it acute? Is it chronic? Where is it coming from? Like, it's often somewhere on the midline, so it's really looking through that midline, through the ribs, through the groin, the abdominals, the neck, the withers, like anything that's basically going to correspond to the midline, above or below sometimes. The other one to look at, which we didn't mention, would be kissing spine. It could be related with that as well, with other spinal pain, depending where that kissing spine is. So I guess the biggest takeaway is that don't put it down to just a conformational issue. There will be a reason, and figure out what that is, and then figure out a plan for improving that stability to reduce problems down the track. Do you have any last things to say about it?
Just, making, if you have the awareness of an issue even before it pops up, it's very useful because then you have a place of reference. So being able to observe it, assess it, and address it early is very useful.
Definitely the key. Awesome. So thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights. Reach out with any listener requests for topics you'd like to hear us talk about, as this was today. And if you're a business aligned with our mission, reach out to become a sponsor of the podcast.
We'll see you in the next exciting episode.